November 9th, I went to group health urgent care at around 1-ish. I had waited 30 minutes just for them to tell me to come back in 4 hours or to go to the hospital if I'm in too much pain. I get to Merida Hospital around 2 p.m. I told the nurse that I was having level 8 abdominal pain with a shorter than normal period. I watched a full room go to an empty room while I sat in pain for hours. Once I got in the room, they gave me 1,000 milligrams of Tylenol. That is something that doesn't make my headaches go away. I have no history of drug abuse or opiate use or anything like that. And I told them that my pain was very high. And all they gave me was Tylenol. After finding that I was bleeding into my stomach and I was having an ectopic pregnancy, then they gave me 4 milligrams of morphine. I had to call the nurse back in 20 minutes for more medicine because none of the pain had left. I was told that my surgery would be within an hour if no one had got shot or something. I got there at 2 p.m. and my surgery wasn't until 8. And on top of that, they were not trying to really treat my pain. They sent me home with only 8 5 milligram hydrocodone pills when they knew I was in a lot of pain. I ended up calling 911 the next day because they did not give me enough pain medicine. I could not move or I would be in pain. When they put me on the stretcher, and every time I hit a bump in the hallway, I was in pain. When they put me on the truck, that hurt. Every time they hit something in the road, that hurt. When they got me back off the truck, that hurt. I was just in a lot of pain. When I got there, the same doctor, she was in the room waiting for me. And they all were looking as if they were confused as to why I was back there.
People, 400 of them medical students, found implicit bias exists that may help explain why Black people are sometimes undertreated for pain. Among its findings, medical students believed that African Americans felt less pain than white patients and even thought their skin was thicker. For more on this perplexing discovery, we turn to Dr. David Satin of the University of Minnesota Medical Center and Dorothy Roberts of the University of Pennsylvania. Thank you both for joining us. Dr. Satin, try to describe this disparity for me. Why does this exist and is it new?
So Gwen, we've known that this has been an issue for at least a couple decades. And every now and then a study comes out that underscores the need for the field of medicine, and in particular medical education, to do some work and get it right. So this is a problem, and it's been a problem, and hopefully this study will spur on more activity.
Dorothy Roberts, is this a medical problem or a sociological problem?
It's both. I think what's really important and fascinating about this study is that it, for the first time, links what we've long known as undertreatment of pain for Black patients with doctors, or at least medical students, false beliefs about biological differences based on race. And those beliefs, as the study's shown, are widely held by lay people as well. They're deeply embedded, long-standing myths about racial difference, especially biological differences between races, which goes back to the very concept that race is a biological difference that is widespread in U.S. society. So it's sociological as well as medical.
Dr. Satin, I have to say the thing that surprised me the most was that medical students would think this way as well as lay people. So are they being taught this? Is this something they just bring with them?
Unfortunately, it's both. So medical students, doctors are people too. We live in society and we're exposed to the same decade after decade experiences that determine our beliefs. However, one of the things one of the medical students pointed out to me this morning is that some of these false beliefs seem to peak in the second year of medical school, as students prepare for the boards and have been memorizing these associations to answer on the board exams.
This is a taught behavior or action. This is a conscious stereotype as well as a subconscious one.
Absolutely. It's deeply rooted and fundamental to the way medical education works in the United States. Students are taught to notice the race of their patients, to treat their patients differently because of race, and they're taught that that's because of fundamental biological differences between people of different races. So while this is in part based on myths and stereotypes that are widely held in U.S. society, it's also based on the way students are taught to treat patients in medical schools. It requires a radical change in medical education to address this, not only addressing implicit bias, but also changing the way in which human beings are treated and differences are considered in medical education.